Let's talk about a hidden tax in the US healthcare system. No, not one from the government. I'm talking about a massive, baked in cost that slows everything down and costs an absolute fortune. Today, we're going to unpack a problem that's literally hundreds of billions of dollars big. Just look at this number $248 billion. That's what experts estimate we waste every single year on administrative overhead in American healthcare. It's just a staggering amount of money that isn't going to patients, or new research, or better equipment. So, yeah, the big question is, where is it all going? If it's not paying for actual medicine or a doctor's time, what are we getting for nearly $250 billion? That's exactly what we're about to find out. So, the root of this whole mess is a giant bottleneck. Experts call it administrative complexity, which is a fancy way of saying the system's plumbing is just completely and hopelessly clogged. And here it is, the core of the problem. Up to 30 cents of every single dollar spent in healthcare has nothing to do with patient care. It's all going to paperwork, data entry, insurance claims, just managing the insane complexity of it all. It's not about healing, it's about coordination chaos. And this chaos, well, it has a very real human cost. It's created something that people in the industry call the doctor's unpaid second shift. And when you actually see how a modern doctor spends their week, the numbers are, well, they're pretty shocking. Okay, so a doctor's average work week is almost 58 hours long. But check out this breakdown. Less than half of that time, just 47%, is actually spent face-to-face with patients. The rest, it gets eaten alive by paperwork, documenting in the electronic health record, or EHR, and just pure admin tasks. And this is where it gets really crazy. Think about this. For every 1 hour a doctor spends with you, the patient, they're spending almost 2 hours on a computer doing desk work. The whole system's priorities are completely upside down. This massive imbalance has led to this phenomenon that doctors call pajama time. And yeah, it is exactly what it sounds like. It's that unpaid second shift. Doctors go home, put their kids to bed, and then they log right back into the system to finish the mountain of charting from the day. This isn't just happening sometimes. It's become a structural part of the job. And look, this goes way beyond just feeling burned out. This constant, grinding administrative stress has a real, measurable effect on the brain. It literally weakens the connections in the prefrontal cortex. You know, the part of the brain you need for complex decisions and empathy. That cognitive fatigue directly raises the risk of medical errors. So this administrative overload, it's a direct threat to patient safety. So how in the world did we get here? Well, a huge piece of the puzzle, believe it or not, comes from the dangerous legacy of a surprisingly ancient piece of technology. Get this, an estimated 70% of all communication in healthcare is still done by fax. Seriously, in an age of instant everything, the fax machine is somehow still one of the main ways we share critical patient information. And to see just how inefficient this is, just follow one document. A doctor makes a perfect digital note in their system. But to send it, they have to print it to a fax, turning that data into a flat image. Then, at the other office, someone has to manually scan it, upload it, and then another doctor has to read it and manually type all the key info back into their system. It's this insane digital to analog to digital loop that makes no sense. And what happens when you have humans manually typing in data all day? Mistakes, lots of them. Studies show the error rate for this kind of manual data entry is over 9%. One wrong number, one misplaced decimal, and the consequences can be huge. This quote really puts it all into perspective. 80% of serious medical errors come from miscommunication. And that includes all the delays, the lost info, and the transcription mistakes that are just built into these old fax-based ways of doing things. It's a straight line from bad process to patient harm. Okay. That's the problem, and it's a big one. But the good news is, people are trying to fix this. There's this whole world of AI tools being built to help. But, and this is a big but, it's super important to know that not all these tools are designed to solve this specific problem. You've kind of got a few different flavors of AI out there. You have ambient scribes that listen in on live conversations and take notes. Then you have clinical summarizers that can review a patient's entire history. But notice what's missing? Neither of those is built to handle that constant, chaotic flood of new faxes and PDFs coming in the door every day. That requires a whole different kind of tool.
And that's what's leading to this whole new category of solutions. It's all about providing intelligence right at the front door, right when that new information first shows up.
People are calling it point-of-entry intelligence, and what that means is it's AI that tackles the very first mile of that data journey. It takes that messy flood of faxes and PDFs and instantly turns it all into structured, organized information that a computer can actually understand before a human ever has to touch a keyboard. So where does this make the biggest difference? Well, you use it on the most painful, fax-heavy jobs. Imagine automating the entire referral process, or streamlining how you bring on new patients, or intelligently sorting through lab results to flag what's urgent. And you know who this helps the most? It's a total game changer for smaller, independent doctors' offices that don't have huge teams of admin staff. It levels the playing field, automates all that painful document review, and gives doctors back the one thing they need most: time with their patients. Which brings us to this final, really big question. We've seen how something as simple as a fax machine is a symptom of this deep, broken system that causes burnout, mistakes, and waste. So, could highly targeted AI, not as some magic cure-all, but as a precision tool for that point of entry, could that finally be the thing that fixes one of healthcare's oldest and most stubborn problems?